Did you know that Governor Green just signed a bill that treats unhoused and mentally ill people remarkably similar to a new executive order by President Trump? On July 24th, 2025, President Trump signed an executive order titled Ending Crime and Disorder on American Streets. This executive order directs states and the Justice Department to criminalize unhoused people and to rely on institutionalization to deal with people struggling with mental health and substance abuse. It also threatens federal funding for evidence-based programs like Housing First and harm reduction. This is a blatant disregard of best practices and instead embraces harmful stereotypes about the unhoused. A punitive approach is simple and attractive, but ultimately will not keep communities or unhoused people safe. Instead, this executive order provides funds for states and cities that embrace the president's program of punishing and criminalizing the unhoused. Unfortunately, Governor Green strongly welcomed the funding attached to compliance with President Trump's executive order. When our state is aligned with a federal government that has made clear its disdain for the unhoused and mentally ill, and that ignores evidence-backed best practices, this should give us pause. In fact, when it comes to policy, unfortunately, Hawaii actually beat the president to the punch by about a month. SB 1322, a bill introduced by Governor Green, was passed this legislative session and went into effect upon its signing at the end of June. Among other things, SB 1322 significantly expands the ability of the state to involuntarily hospitalize people, even if they have not committed any crime. It also bolsters the ability of the state attorney general to access private medical records of individuals and reduces the number of medical professionals required to approve forced medication. The expansion of the government's ability to mistreat vulnerable individuals and to make overreaching decisions about mental health and housing, it sounds an awful lot like President Trump's new executive order. Forced hospitalization of people is an out-of-sight, out-of-mind policy that is not a real solution. Instead, it creates a revolving door that will cause overflow in our hospitals and put strain on resources and staff. We also cannot medicate our way out of a housing crisis. There's a risk that forced medication will be used indiscriminately, even for individuals who would not benefit from long-term medication, like those with substance abuse issues. Violating the basic rights and dignity of individuals in the name of expediency, or worse, because the state thinks it knows best, raises serious legal and moral concerns. Hawaii cannot chase solutions that are simple, but ultimately ineffective. It cannot justify violating rights for an entire group of individuals in the name of helping them, without embracing a paternalistic worldview. If we allow the government to disregard our rights because it believes it knows best, what's to say that this same approach won't be applied more broadly?